Hey guys, welcome to part 2 of my journey to greatness with Malebo, the genetic counselor.
But I think the most important thing that we do is the psychosocial stuff. So the counseling part where we're helping you to adapt to this new diagnosis, help you to deal with any fears or concerns or uncertainty that you may be facing, or any other, people have a lot going on in general, and now we're going to come and add this on to you. We have to help you accept it or lead you on a journey to acceptance, because it takes time sometimes to accept. So the psychosocial part is the really counseling, getting into it, dealing with the patient issues and any concerns that they might have. And from time to time, then we have to refer to a support group.
Oh, okay.
For the ones who we feel would really benefit a support group. Others, depending, because people have different things that are going on, others may need referral to psychology for more counseling.
Oh, okay. Do you also counsel? You do counsel?
We counsel, yes.
But then you can take them for psychological counseling as well.
Because remember, we are not general counselors or psychologists, so we will talk to you, we will deal and discuss and go through the issues that you might be facing, but the context is within the genetic condition or whatever condition we're seeing you for. So if I'm seeing you, for example, the Down syndrome, and it's the first time and you're in shock that your child has this condition, we probably could talk about how you're feeling, what do you think about the condition, who do you think you're going to tell in the family, will you tell them, do you need help to tell other family members, and things like that. But should I pick up that, no, maybe you've got depression, and usually some of these things are not even related to like the child with Down syndrome, they've had other things happen in life, and if I can realize through all of that counseling and talking, then I can be like, okay, would you mind if I referred you further for a counselor, because I think it will really help you deal with those issues. We do have people from time to time that really struggle with whatever the diagnosis is. We see them once, twice, 3 times, and you can see that they're really not coping, and then you have to refer them to psychology. Because although we use some of the psychology skills in the counseling, but we're not providing like a proper psychology session, because the context is, though we deal with your general life, we're not general counselors. Our context is the genetic condition and counseling.
And then do you work like for private or public sector?
Me?
Like, no, I mean as genetic counselors.
Yes, private and public centers. So you can work in public at state hospitals. Private, they can have their own practices, or be part of like a group. So I know others have their own practices, but will form a group with other doctors and health professionals in a certain center. I mean, we've all been to some medical centers in Cape Town where you see it's a multidisciplinary team in those offices. And others are employed by private labs, so like Pathcare and others. I'm not advertising for them. They just came to my head first, but labs such as Pathcare, because they do genetic testing, they would have genetic counselors that work for them. And that job then involves, because remember, we learn how to do everything, even to interpret genetic test results. And the importance of having genetic counselors in genetic labs is they can also help interpret those. And because it's in a private setting, not everyone was seen like by a genetic counselor or a medical geneticist. So genetic counselors can say sometimes that no, but this testing that was chosen here is not appropriate.
The correct one,
yeah. So then they help with the communication with doctors and explaining things to the doctors, and sometimes they do get to see patients on the side. So our job is
you everywhere. So you go from testing to analyzing, and then to counseling as well.
And not so much analyzing, but interpreting that, because the analysis and the stuff, they do I think the bioinformatics and the other people will do and say, and also the scientists will say this is the result, but interpreting it for the family is quite important.
Okay. Wow. Okay, I've learned a lot about genetic counseling. And anyways, so I want to talk about you now at UCT.
Yes.
You're doing genetic counseling. Is it what you expected it to be?
What, the course?
Yes, the course. Yes.
I think yes and no. So When because remember Prof. Kate Scott was doing some of the modules.
Yeah.
So she would tell me a lot about it when I was still in my 4th year.
Oh,
And
that's nice. And like you were her favorite, shame. Like she loved you.
Coming back to that, so Prof. Catherine Scott or Kate Scott, she would tell me about it because she was doing some of the module work that we do in genetic counseling. So I had sort of that little bit of preparation, but I think because there was no one who was doing genetic counseling that I was communicating with at that time, there was no one to really tell you that actually emotionally it's a lot of work. And your first year and your second year, what I always say is if you're not sure, like over the years I've learned, if you're not sure that genetic counseling is what you want, please don't do it.
Sure. If you're not sure.
Yeah, if you're not sure, if you're like, hey, I'm not sure, let me just do it because of I just need to do a master's because it is challenging in different ways. Everything in life is challenging, but the challenge that it presents to you needs you to really want it. During our first year, we're doing our four coursework modules, and you also have to start doing clinics, so start learning how to counsel. So you're going to the clinics that you are allocated to on the rotations in the different hospitals. And then on top of that, you have like assignments, or we call them case reports, that you must submit. And in addition, you have to start with your research, and we had to submit our proposals, I think by like April of our first year. Remember?
April of first year?
Yes.
Oh my
April,
God.
May the latest. That's when we had to submit our
like,
proposals.
You're still
for
finding
research.
your feet.
Exactly. That's why I say if you're not really sure about it, don't do it when you're not really sure that this is what I want, because the challenge is different. But because we see such challenging things in clinic, and you can imagine how the emotional stuff gets very emotional and it also impacts you as a person, you really need to want it, because you will leave it, you will quit.
Sure. Have you had people quitting?
No, not so far.
Well, at least.
Because they all want to do it. But the amount of effort it needs from you, it's the amount of effort that you need to put in, because this is what you want to do and what you want to become. So I think on that level, I wasn't prepared for some of it, but because I'm always willing to learn, I will. And we have what we call supervision, where we can discuss cases with our supervisor. I think I used to take those opportunities to learn more, and it was quite interesting for me, and I really enjoyed it, but it needs you to put in the work. You must be willing to put in the work.
Like, I remember when I was at UCT, what I tell people is you need to reach your maximum potential and just go a bit above that for you to do it.
Yes, you're like, this is my maximum potential and I'm going here.
Yeah.
And the other thing, I'm very adaptable, Risha. Like, you can move me anywhere, I will be fine, I will adapt. And I think that was my biggest strength, is be malleable. Malleable, I think we were talking about metals and physics. I'm assuming, guys, if this is wrong, please don't get me, but malleable, I think it means you're bendable. I might be lying.
Yes, you're right.
When we're talking about all the types of metal and physics, I remember that, and that's how you need to be as a person. You need to be bendable. And I'm not talking about bending your values. I mean, you must be able to adapt to the different weathers of life. And be able to move. So when I moved to UCT, I don't think I had a hard time with being in Cape Town.
Really?
No, I'm very adaptable, but I'm also an only child. We're just naturally independent.
Oh, sure.
It's a natural thing you're born with. I think once God has said, okay, this one is going to be an only child, then you have a natural ability to
I don't know, Malebo. I'm not the only child, but I feel like the only child because my little sister is like 10 years younger than me. But I don't know, like you just have that strong thingy, and that's why I got nervous in this interview.
Why?
Because like you just, I don't know, you come out very strong.
Like, I didn't know that. You
really do. Like you've not in a bad way, but it's somebody will not waste your time. Like when they look at you, they like, this one, she knows what she's talking about. And for me, I struggled. Like adjusting was a lot. Just adjusting, having to have like white lecturers, being in class with white people for the first time. all that was, it was too much. I took a while for me to get comfortable, then now focus on my studies. And mind you, when I'm getting comfortable, it's not like school is waiting. You need to do school as well. But I'm glad you actually found it that way.
But remember, also I grew up in Gauteng, right?
Oh,
and I went to multiracial schools.
Oh.
And actually, all my teachers, but one high school teacher who taught us accounting, everyone was white.
Oh.
So I didn't have a culture shock in that sense. But Cape Town culture is different to begin with. Like, it's a whole different culture. And it doesn't mean that we all don't have little cultural shocks, like even clinic, how some things you would be expected to do. And then when I think of how I've been, I remember I was being told that I'm being too respectful. I never knew that was a thing. But they weren't saying it as a bad thing though. They were just saying that you can be respectful, but just be a little bit with the patient, you know. And we'd get information done and whatever, but I think it was just saying that also, I don't think they were used to that amount of respect because I come from a home where everyone is super respectful.
Just to share my own piece of respect, when I started working, I would call my supervisor Mister all the time. That's so annoying. And I would forget. I was like, Mister, and she's like, no, just call me by my name.
Even now, I really struggle with that because I wasn't taught to call adults by their name, you know?
Yeah.
And it's not a thing of that maybe I feel inferior. I don't feel inferior necessarily. Maybe some people do make you feel very inferior, but it's a thing of I'm respecting you and I'm going to show you that. And I come from a family where we have to be, like, from childhood it was drilled, like, but they also, the other thing is they tend to be quite respectful to us also. For example, my gran, if she gives you food, she will still curtsy. She will still curtsy for you and give you the food, you know, because respect is not even about age. So that's where I come from. So I still call it, especially like my supervisor, I call her Dr. T, I call my other one Prof K, call the other one Prof.
It's easier though when they have those titles. Because if now you're going to say Mrs. So-and-so, then that's just like...
Yeah.
But then if they have a title like that, then it's much easier.
But some have told me, no, just call me by whatever, and I'm like, yeah, no, it's tricky.
Yeah.
It's tricky. I think those were the culture shocks that I had to work with, and eventually I had to make a decision that, you know what, this is who I am. It's not affecting me in a negative way, and I can't be changing certain things about me and be uncomfortable because that's the norm of the world.
Yeah.
Because if you, I mean, at some point you'll get used to just calling the person by name, but if it really makes you uncomfortable to call someone by their name, I don't think it's always a deep, bad psychological thing. It's just that you're just trying to be respectful, and there's nothing wrong with that. I
struggle even up to today, especially if somebody's like, hi Shongi, and then I'm like, hi Malebo. I'm just like, yo, Malebo is a bit old, you know, like
exactly.
I still feel, I'm just like, hi, because I don't want to call you by your name. I don't want to call you Sisi because at the same time we're at work. I don't want to call you Mama because I don't know how you feel about that.
I think the greatest thing is when I work with patients.
Yeah.
With my black patients, the older ones, for me, I can't speak for other people and their experiences, but I have experienced such things where I try to call them by their name because when other people call them by their name, they'll be like, oh, hi Rishongile, and you're like a 45-year-old. And I've tried it once or twice or 3 times, and I get the look of, when a young black child, why aren't you like giving the respect, you know? So, and there's certain things they say we really shouldn't be doing in genetic counseling, like call an expected mother, mom, because what if the child's not going to be okay? But I had to explain that me and this woman's interaction of being, hi ma, how are you doing, how things are, what, it's not coming from the fact that I'm calling you mom for the child. I'm calling you ma because you are an elder. And my patients really appreciate that because even how they're super comfortable with me, they'll tell me stories and we'll discuss things, and they really see that you are respecting them. It's not a thing where if I was maybe a different skin tone, so if I was white or colored and call them by their first name, they tend to accept it better than when it's me doing it to them as a black person, you know. And I also see it with the ladies who, because it's mostly women, we haven't had men cleaners where I am, and if I just go morning, or morning whatever their first name, they never seem impressed. But the moment you say, Monoma Unjani, you can see how they light up.
But that's part of our culture.
It is, and you have to address people appropriately. And even with patients, I think that's why they teach us a lot of cultural competence for me to be able to adapt to different people's cultures, I know that if there's a man there then who's older, then calling him sir is better than just calling their name, because sometimes you'll be like so and so when you call them, and then we usually do ask that how would you like me to call you, and they will tell you, but some of them just prefer being called sir because you're younger. So it's a cultural thing that,
like, if you guys have been here since before 100 subscribers, I've talking about my journey, my academic journey, where I talked about how I actually got to do forensics and all that. And I wanted to do genetic counseling. Like, I think I was stressed the entire month just to make the decision between genetic counseling and forensic science. And one of the reasons why I did not choose genetic counseling is because I was not sure of my future in genetic counseling. So how does the future in genetic counseling look like for you? Because I know that you had to do 2 years of your master's and then do 1 year of internship, and then after that you go and work. But the working part for me, it was also not clear. Like, there was no thing of there was no certainty that you will get a job. That was how I felt at that point, and I did not want to get frustrated with that part. So how was it for you? How did you find it? Or how, like, you have walked that journey that I was scared of walking, you have walked it, and how does it look like?
We all know that we don't have enough genetic counselor posts in the country, but it shouldn't make you afraid of doing genetic counseling. And I remember even trying to say this to my peers at University of Limpopo, that please don't think small. Like, you're applying for masters, but why are you only applying in Pretoria? Because that's the only place they're familiar with. They've only gone from Limpopo and visited Pretoria. And I remember telling the one lady that when there's so many universities around the country, apply for masters far, apply for internships far from. You don't need to be at home after doing this, because you need to be able to learn about the world. If you want to go back home, then go back home after that, So I think with it, even though we don't have a lot of jobs here, but so far the jobs are increasing bit by bit. We are now starting to see posts come here and there with more awareness about the job being created. So none of my peers that I was in the same class don't have a job or don't have like a practice of their own. And the beautiful thing is that when you train here, you can go work in the UK and they don't make you redo exams and that. So we have a few people who've done genetic counseling here. They work in the UK. I know one who works in Oman, which is in the Middle East, the country there. So unless you're really attached to being home, if you want to do the course, come into it. And if you wouldn't mind, then if there isn't a job immediately when you finish in South Africa, but you don't mind going overseas for a year or two until one that comes up that's here, then do it, but so far posts do come up, but like everything in the world, it is what you make of it. And I don't know, I've never been worried about getting a job, because you do your 2 years masters. We do need 2 years internship, but your other year of internship is done during your second year of your master's. So your first year is done then, and we automatically go into an internship program. We don't have to apply for internship unless I want to do it at like VITS or wherever, then I have to apply. But if I want to stay there, then I stay there. And then I started my PhD in my internship, which was also hectic. So I think so far jobs are coming, and they're coming up a bit slowly. But if you're really passionate about it, you can go work in other countries if there isn't a job.
Hey guys, thank you so much for watching part 2 of my journey to greatness with Malebo. Please look out for part 3 coming tomorrow.